So a lot of people have been coming to my clinic, and Nikki also has been complaining about knee pain since she's been starting a bit more miles on the bike. And a lot of people are getting a lot more activity outside, maybe running, cycling, and they start to complain about knee pain. So I'd like to create a video with a couple of simple things that you can do at home that'll start to kind of care for your tissues, but also maybe ameliorate some of this knee pain that you've been experiencing. One of the things I like to start off with, foam rolling. We got this cool Hyperice vibrating roller that kind of helps to, one, loosen the tissues up a little bit over a short period of time, but the vibration also helps to blunt some of the discomfort that you might be experiencing when you do foam rolling. Because when you compress the tissue against other structures like bone, it can become very uncomfortable. Or if you have tissue that might be a little bit more sensitive because it might be the first time you're doing it, or because they might be sore from activity, it's a great way to blunt some of that soreness that you might be experiencing. So I tend to start off with about 5 minutes of foam rolling of the thighs, the hamstrings, the calves, and up through the hips to get the tissue ready for a little bit more directed stretching and mobility work. So as you see here, Nikki's unloading her thigh with her left knee, but she's also going to try to get the outside of her thigh. She's going to try to get the inside of her thigh or groin a little bit, and then right down the center where there's a couple of different muscles that are attached to your thigh that are really responsible for slowing the body down, absorbing a lot of force, especially when you're doing activities like running, or when you're cycling. There's a lot of repeated activity because of that pattern of just pushing the pedals down repeatedly. I think it's worth also saying that a lot of people advocate rolling out the IT band. The IT band is a thick fibrous band of tissue that goes from the side of the knee up towards the top of the hip. And that's really close to the side of your thigh bone. And when you compress that, it hurts quite a bit. And it's very difficult, if at all possible, to stretch that tissue with just compression alone. So what I like to advocate, I like to stretch and roll on the margin between the thigh and that tissue on the side, and also where the hamstring and the back of the thigh meet. So you're off the IT band, but you're not rolling on top of it. Because there are two places where the muscle and the tissue come together. They can kind of get glued down, and this will help to kind of reduce some of that compression in that area. And it can help you with some of the symptoms you might feel from IT friction syndrome or ITB band compression that you might be hearing as some of your diagnoses. So here Nikki's rolling out her hamstring and kind of doing what we were just talking about, rolling on that side of the thigh behind the hamstring, and as it comes towards the side of the thigh, but she's staying off of the IT band. So Nikki, why don't you cross your right ankle over the top of your knee? Yeah. Or go to your right glute. Yeah. Your right glute. Your other right glute. Thanks. Good. Yep. So right there, cross your right over your left knee. Right there. And now kind of get on the side of your hip a little bit. And that's a great way to kind of open up the hip a little bit, create a little bit of vibration through the rotators of the hip, and also stretch the capsule of your hip out a little bit.
Do me a favour, just step out of the shot on that one. Like, move towards your camera. Just get up. So yeah, this is a good stretch. I didn't know this. This is a good one. Even further. Okay. We'll do the stretches. You don't want this to be too long, so you'll just get bored.
Okay. So now a couple of directed stretches that I recommend to people. Really simply, just a simple little hamstring stretch that you can do. You can use a band or a yoga strap or a long towel or a bed sheet to kind of stretch your hamstring out. But what I like to do, I like to make sure that the posture is upright. I like to flex the opposite knee a little bit. Keep the chest up. And we want to reach the logo of the shirt or the chest, keep that proud chest, and lean forward from the hip joint. So we're getting a little bit more, keep the chest lifted, a little bit more stretch to the muscle. Because the hamstring will stretch when we hinge over versus stretching out and rolling through the upper back, which you're not really developing any more tension. You're just kind of stretching out the back muscles, and that's not doing what you'd like it to do. So the reason why we like to stretch the hamstring is because the hamstring not only connects to the back of the knee and also the side of the knee where your fibula is, this bone right here. A lot of times people will get pain there, but it also has bands that connect into the capsule and it can compress the knee joint. So if we stretch the hamstring, we can also release the pressure on the front side of the knee.
Okay.
So now, importantly, we want to make sure that our thigh is flexible. So one of my favorite stretches that I like to do, I have the client lay on their side. The leg that's going to be stretched is going to be up. The bottom knee is going to be flexed at 90 degrees, and I instruct them to hold the back of their knee. And the reason being is because we don't want to extend the hip. If we release the thigh, release your thigh neck, release this. Yeah, we get a lot of extension through the spine, and we miss this. So what we like to do, we want to hold and stabilize that thigh, and we want to make sure the spine is in the middle position, not extended. And I instruct them to use their glute and just kind of kick back. And this is going to stretch the two joint muscle that crosses the hip and the knee, which is responsible for a little bit of hip flexion and also controlling a flexion component of the knee. And it also is a great one for the underlying thigh muscles too. So when we do these stretches, anywhere from two to three stretches per side, 20 to 30-second holds. The literature shows us there's no real increase in benefit after a 30-second prolonged stretch. So we want to repeat this frequently throughout the course of the day. Doing it one time or twice really isn't going to yield the benefits that you'd like. So the more frequently that you can do it, up to 3 to 4 times over the course of the day, maybe 4 times a day, will get you to your goals faster. One of the other ones I'd like to show you, we're going to roll over onto our belly. Okay. We're going to bend the knee. We're going to take the band. Okay. We're going to loop it around the ankle again. Again, it's really simple. But what will happen is that you can see Nikki kind of props up. So you get a lot of hyperextension. So I like to bring the chest to the floor, right? And what we can do is that you can also use the glute to lift up, and you can pop up a roller or a towel to get a little bit more of the thigh. But what we're looking for here is the ability to get the heel to the glute. If we can get the heel to the glute, you have a pretty good range of motion through the knee joint, as well as flexibility through the quad muscles that are on the front of the thigh. But if you extend and all of a sudden this heel pops up, you know you have a limitation, that two joint muscle called the rectus femoris, and we've got to give that a little bit of love, whether it be rolling, maybe you've heard of scraping or soft tissue manipulation with the tools. That's popular now, and I use it for my clients that need it. They have either adhesions or motion limitations. It's a great way to kind of get the tissue to kind of lengthen and also be able to transmit force and lengthen appropriately so you can get the most out of your activities and the most out of your muscles.
Perfect. Can you move that shot for a second?
GoPro, stop recording.